smooth channel. Today we're going to talk about diaphragmatic breathing and the importance of correct core activation. So what is diaphragmatic breathing? Diaphragmatic breathing, also known as abdominal breathing or belly breathing, is a deep breathing technique or exercise that allows us to fully engage the diaphragm, a big dome-shaped muscle at the base of our lungs, during each breath, and increases the efficiency of our lungs. When you inhale, the diaphragm contracts, tightens, flattens and moves downward, creating more space in the chest cavity, sucking air into your lungs and allowing them to expand. Then, as you exhale, the opposite happens. The diaphragm relaxes, moves upward into the chest cavity, creating less space in the chest cavity, and presses the air out of your lungs. You can think about the diaphragm during each breathing cycle as an umbrella, expanding as you inhale and contracting as you exhale. When we are born, we all breathe diaphragmatically. Just watch a baby breathe. When babies inhale, their bellies rise, and then the belly falls again as it exhales. But as we get older, however, we get out of the habit of fully engaging the diaphragm when taking deep, refreshing breaths, and gradually convert to a shallower and less satisfying chest breathing. Yeah, the biggest factor impacting this shift in way of breathing is the increased stress of everyday life. So, by relearning how to breathe properly is very valuable for everyone, not only pregnant or postpartum moms. It encourages full oxygen exchange and helps reducing stress. Studies on diaphragmatic breathing for stress reduction have reported that by practicing diaphragmatic breathing, your heart rate slows down, your breathing rate slows down, the peripheral temperature lowers, and it lowers and stabilizes the blood pressure. So, how to perform the diaphragmatic breathing? You can do the diaphragmatic breathing in almost any position, sitting, standing, on your knees, or lying on your back with your knees bent, although avoid this after approximately week 20 of pregnancy. If you're sitting or standing, you can place your hands on your bump or your stomach if you're not pregnant, to help you feel the movements better. Start by taking a deep breath in, and then as you exhale, think about pressing the air out of your lungs with your whole core. Some pregnant women like to think of hugging their baby with their core muscles. What I mean by your whole core is that we're going to engage each core muscle, beginning at the bottom and working our way up, scooping from the lower abdomen, tightening your core from downwards and up. So I'll break it down. As you begin to exhale, engage your pelvic floor muscles. You feel it comes together and lifts up. And as you continue to exhale, engage your abdominal muscles, both at the front and the transverse abdominals on the sides. That's why it's good to keep your hands on your belly to feel these muscles contract. So you're kind of creating a wave of muscle contraction, starting in your pelvic floor muscles and then moving up as you exhale. This way you can think of it as you're pressing the air out of your lungs with your core muscles. Now as you inhale again, relax these muscles that you have now contracted, thereby expanding your ribs and belly, and focus on releasing all muscle tension, including the pelvic floor. Notice the difference between the shallow chest breathing and diaphragmatic breathing with correct core engagement. With the shallow chest breathing, we have no core support. Tension increases up into the chest, neck and shoulders, and it's very uncomfortable. But by doing the diaphragmatic breathing, we breathe better and we engage the core correctly. General and pregnancy-related benefits of diaphragmatic breathing include helping you reduce stress and relax, strengthens the diaphragm, decreases the work of breathing, encourages maximum oxygen change, improves muscle function during exercises, preventing strain, stabilizes blood pressure, lowers heart rate, helps in managing intra-abdominal pressure during exercising, protecting the pelvic floor from excess downward pressure, and correct core engagement while exercising during and after pregnancy. In addition, it has also proven to be especially beneficial for pregnant women with gestational diabetes. But one study reported that diaphragmatic breathing exercises decrease respiratory rate and levels of fasting blood glucose among pregnant women suffering from gestational diabetes mellitus. This breathing technique involves a relationship between the diaphragm, your abdominal muscles, and the pelvic floor, cooperating in intra-abdominal pressure management, that is, adjusting the pressure within your abdominal cavity. As your pregnancy progresses, the baby takes up more and more space, pushing your internal organs upwards toward the diaphragm, leaving less room for the lungs to expand during each breath, and leaving you short of breath when attempting the simplest tasks. Also, as your baby grows bigger and heavier, the pressure down on the pelvic floor increases, weakening and stretching the pelvic floor muscles, which is a band of muscles that stretches across the bottom of the abdomen, supporting or holding up your pelvic organs, which include your uterus, bladder, and bowel. Both pregnancy itself and the birthing process can lead to pelvic floor problems that can remain long after giving birth. Symptoms and signs of a weak pelvic floor and pelvic floor problems can include vaginal heaviness, leakage of urine, pelvic girdle pain, lower back pain, pain during intercourse, and constipation. It may also lead to a prolapse of your pelvic organs. So strengthening the pelvic floor is therefore crucial both during and after pregnancy. And we need to be able to connect to our pelvic floor and control the pressure within the abdominal cavity as best we can. This is not only important during exercise, but also in everyday life during pregnancy and after giving birth. Why is diaphragmatic breathing important during workouts? Two things: better breathing and correct core activation. When we work out, diaphragmatic breathing helps us breathe deeply enough to ensure sufficient oxygen delivery to the muscles and helps us activate the core correctly throughout the exercise we're performing. Engaging your core with diaphragmatic breathing when you're performing various exercises prevents excess downward pressure on the pelvic floor muscles, as they are engaged and strong throughout the movement. However, if you, for example, go down into a squat without engaging your core, and then press yourself up again, especially if you're holding your breath before standing up again, the pressure from the abdominal cavity down on your pelvic floor is much higher. And your pelvic floor muscles are not engaged or contracted, so they just give in and bulge down from all the pressure. Hope you found this helpful!